Every single day, Americans die from preventable deaths. Save with CPR is looking to change that. You are about to receive life-saving education from Save with CPR, so please make sure to give us your full attention because during an emergency is not the time to be helpless. My name is Drew Toma, founder of Save with CPR, career paramedic, and educator. I have the honor of being invited into people's lives on their worst days to make things better. With that honor, I've had to tell countless families that their loved one has passed away. Many times it was unpreventable, but sometimes it was preventable. I think about those people and their changed lives quite a bit. If I had just 30 minutes with the families, friends, or coworkers there that day, I could have given them the tools and the training to prevent their loved one's death. And so it's my mission, my life's goal, to help educate and empower as many people as possible, so your loved one has the best chance of survival. Now please join me as I show you how to save with CPR. I think I just recognized an emergency, which is the first step to recognize an emergency. You have to be open to obvious as well as ambiguous signs, such as loud noises, a person not moving, someone who appears to be confused, bleeding, or even contents leaking out of vehicles or containers. If you suspect an emergency, don't immediately move towards it, but instead call 911 from any phone within the United States. They will first need to know your location of where you are, then they'll ask details about the situation. Also, never be afraid of calling 911. Even if it isn't an emergency, nothing bad will happen. It's better to call and not need it than to not call 911 in an emergency. If you call 911 by mistake, that's okay. Stay on the line, talk to the call taker, let them know that this was a mistake. Otherwise, they'll have to spend resources trying to find you. So now that we've recognized an emergency and help is on the way, should we jump in and help? Well, not so fast. You can't render aid if you become a victim yourself. So never enter a scene that is potentially unsafe. If you see multiple people not moving, it's not safe. If you hear gunshots or other ominous sounds, think about those horror movies and the characters that go to investigate. No thank you. If you see fluid leaking from a vehicle or a container, or if you see downed telephone poles, do not approach. They may be energized, the contents that are leaking could be hazardous. So again, call 911, activate first responders, and help other people not approach or enter this unsafe scene. Also, if you're in or around the road, understand that many first responders and tow truck operators die every single year from bad drivers and accidents. So stay away from the roadway if you're able to, especially with vehicles whizzing by. If you're ever stranded on the side of the road, get yourself as far away from that road as possible, including the other side of the guardrail. I can't list everything, so use your common sense and don't run into a situation where you may become a statistic. I think I see someone in a safe area that I can help. Hello, I'm Drew and I'm Save with CPR trained. It looks like you need some help. Do you mind if I help you? Now notice how I introduced myself as a trained responder and asked the person for permission to help. That's called expressed consent. Just because someone is injured doesn't mean they lose the ability to make their own decisions. With express consent, the person has chosen to accept our offer for help. On the other hand, if a person's unconscious, we get implied consent, as it's implied that the unresponsive person would want to be saved, would want our help. It's also important that you're not afraid of providing help. All 50 states have Good Samaritan laws, which protect you from legal liability as long as you act within your scope of training and you're being reasonable. Each state's different, so I suggest you research your state's Good Samaritan laws. But keep in mind, these laws do not protect you from injury or disease. That's why it's important to utilize personal protective equipment, or PPE. When dealing with bodily fluids, it's important to recognize that we may be exposing ourselves to disease, which we probably don't want. So what can we do to stay safe? Well, make sure to put gloves on before touching anything. We have a saying in EMS, if it's warm, wet, and sticky and not yours, don't touch it. So make sure you properly remove your gloves when done, and do not touch your face until you've washed your hands with warm running water and soap for at least 20 seconds. The last thing I'll bring up before we move on is being kind to and helping yourself. Seeing, responding to, and being involved in emergencies, injury, and death are big life events. These events can consume us and our lives in a negative way, especially if our rescue efforts are unsuccessful. I want you to know that despite your best efforts, you're not guaranteed to be successful. You did everything you could because you care, and I commend you for that. It's important to talk to a mental health professional after something like this, as they can help you work through these difficult life events, complex feelings, and most importantly, give you your life back. The last thing anyone wants is more loss. Thank you, and I look forward to seeing you for the rest of your Save with CPR training. Welcome back. In this video, we're going to lay the foundation for your CPR, AED, and choking relief training, especially as it relates to various ages. So we're going to go over a few things. What is CPR? How do you recognize cardiac arrest? What are chest compressions? How do you perform them? What is an automated external defibrillator? How do you use it? What is rescue breathing? How do you perform rescue breathing? Why would you do rescue breathing? We're going to go over choking, and then you're going to do a review. Okay, so the big question, what is CPR? Why is CPR? What is cardiac arrest? What do we even do? So let's go into the anatomy and physiology a little bit. I'll try to keep it interesting. Your cells keep you alive. Right? And so for your cells to be able to do the things that they need to do, they need oxygen. Right? Your cells need resources to be able to perform their functions of keeping you alive. Well, how do the cells get these resources? Well, they get these resources off of the blood. Right? So your blood circulates throughout your body, through the vasculature in your body, and the cells are able to grab the resources that they need. As they make energy, they're able to put waste products back into the blood, and then it gets removed elsewhere. And so these cells need a supply of resource-rich blood to be able to function, right? And so how does the blood circulate throughout your body? Your heart. So every time your heart beats, you get a little more circulation of blood. It beats again, you get another circulation of blood, it beats again, right? So on and so forth, and that's how your body's able to circulate this blood. Now, when we get to rescue breathing, we'll talk about, okay, you're circulating blood with the heart, but how does the blood get the resources? Well, when you breathe in from the atmosphere, the oxygen that you breathe in is then put onto the blood, right? So every time you breathe, that puts the oxygen onto the blood. Every time your heart beats, it circulates a little bit of blood. And so you breathe, you put oxygen onto the blood, your heart pumps, 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 and it circulates the blood throughout your body. So cardiac arrest is the term for your heart not beating, right? And so in cardiac arrest, you're not circulating blood, you're not breathing, so you're not putting oxygen onto the blood, and so your cells are starving. And so what CPR is a system of interventions to take over for these systems, to circulate some blood, to put oxygen onto the blood, to make up for these failed systems until first responders can arrive and do some more definitive care. It's really important to make sure when checking for signs of cardiac arrest, you never spend more than 10 seconds. But what are the signs of cardiac arrest? Well, if you're comfortable feeling for a pulse, that's the definitive way to tell if their heart's not beating. Chest compressions are your ability to take over for a failed heart. You can take one hand over the other, place them over the center of the chest of the victim, making sure to lock your arms. You're then going to push straight down at a rate of 100 to 120 times per minute. You're looking at adult chest compressions, but the principle will remain the same for children and infants. As you push down on the chest, you're compressing the heart, getting an ejection of blood. As you release your pressure off of the chest, you allow the heart to refill with blood in preparation for another chest compression, and this process will continue. So that's all chest compressions are. The heart has stopped. Right? The way the heart works is it squeezes and we get an injection of blood. So the heart stopped. You push on the chest, get an injection of blood, let go, it refills, push back on the chest, we get another injection of blood. And that's chest compressions. And one of the interesting things is if that's all you do, you're going to help save the person. If all you do is recognize cardiac arrest, call 911, and do chest compressions only, you're going to help save this person. So those are chest compressions. Now what's an AED? Well, an AED is an automated external defibrillator. And so the heart to contract has to be told to contract. So there's an electrical system of the heart. Well, sometimes this electrical system goes a little haywire, right? And it needs to be reset. So to be able to reset the heart, we need to send a jolt of electricity through the chest of the patient, through their heart, stopping all of the electrical activity and allowing it to restart. So an AED, you open it, you need 3 steps. Turn on the AED, place the pads on the victim, and just do what it says. Right? And so when you power on this AED, you put the pads on the patient, the AED is able to analyze or interpret the electrical signal of the heart. And it's able to determine, is this a normal electrical rhythm? Is this abnormal? And if it's abnormal, does it need to be reset? And if it needs to be reset, the AED is going to say, stand clear, shock advised. It's going to charge up, and then it's going to say shock advised. The red light will flash. You hit the shock button, a jolt of electricity goes through the victim in an attempt to restart the heart. You immediately go back into your chest compressions. And that's the AED. It's important to recognize that the AED is going to analyze the cardiac rhythm of the patient, and not in every case will a shock be delivered. In some cases of cardiac arrest, the AED will advise no shock and advise for you to continue chest compressions. This is completely normal. We're missing a component, right? We're missing putting the oxygen back onto the blood, right? Because the cells need oxygenated blood. So by doing chest compressions, we're circulating the blood. By putting the AED on the patient, we're attempting to restart the heart. The missing component is putting oxygen back onto the blood. We do that with rescue breathing, right? And so there's a principle called compression to ventilation ratio. What it is for X number of compressions, you should deliver X number of breaths. So in adults, your normal compression to ventilation ratio is 32. So every time you do 30 chest compressions, you should pause for no more than 10 seconds. You should deliver 2 breaths to the victim. This is how we attempt to put oxygen back onto the blood and then circulate it throughout the body so the cells can continue to use it. Throughout this training, we're going to show you the 3 different ways that you can deliver rescue breaths. The first, and what you're seeing here, is with the use of a bag valve mask, which fully isolates you from the victim. Another method is mouth to mouth, where you directly place your mouth over the victim's mouth and deliver 2 breaths. The third is similar to mouth, but placing a barrier device between you and the victim's mouth to help isolate from potential vomiting. Okay, so now let's talk about choking. What is choking? Well, choking is another way of saying airway obstruction. The official term for that is foreign body airway obstruction. This is often food and kids, it could be toys, these sorts of things. And there's 2 types of choking. Right? There's 2 types of foreign body airway obstructions, partial and complete. So partial airway obstruction is where only part of the airway is blocked, but you can get some movement of air, right? So they may be able to have a raspy voice, they may be able to scream, they may be drooling. If you're getting some air movement, only part of the airway is obstructed. So in that case, call 911 and monitor the patient. You wouldn't want to do any choking relief interventions because in that case, it may actually cause the obstruction to become worse. Where we would attempt choking relief is in what we call a complete airway obstruction. So if the airway is entirely blocked with food or another object, you need to attempt to dislodge the object because no air is able to move. So how do you recognize it? The victim will not be able to speak, not be able to move air, they won't be able to scream, anything like that. So if you notice those signs, you need to immediately attempt choking relief. Let's take a moment to review the new knowledge we've gained. Pause the video and spend some time to attempt to answer these questions. Welcome to Adult CPR, AED, and Choking. In this module, we are going to cover adult chest compressions, adult rescue breathing, adult AED use, adult team CPR, adult choking, and we will review. Adult chest compressions. Chest compressions on an adult require you to place both of your hands directly over the lower half of the victim's breastbone. You will need to lock your arms and push down 2 inches. You will then release all of the pressure off of the victim's chest. This should be performed 100 to 120 times per minute. Keep in mind, it is important to make sure you're not resting on the chest between compressions because that will prevent the heart from fully refilling with blood.
Hello, sir. Can you hear me?
Let's walk
Sir?
through the beginning of a
Can you hear
cardiac
me?
arrest. Recall back to our previous video how you will first check for responsiveness. In this case, the victim is unresponsive, so the rescuer starts chest compressions and then will eventually call for EMS. If this is as far as you get in a resuscitation, that's completely okay. By activating EMS, you're starting the first responders who can take over the rest of the process, and as long as you continue high-quality chest compressions until EMS arrives, you are circulating blood throughout the patient. This will greatly increase the patient's chance of survival. If able and willing, rescue breathing for an adult will allow you to replace depleted oxygen in the victim's blood. 3 options of rescue breathing exist: mouth to mouth and mouth to mask, which use the same technique, it's just that one has a mask, and one is your mouth directly on the patient's mouth, and bag valve mask. With either technique, you'll want to provide 2 breaths, stopping once you notice chest rise for every 30 compressions. That's our compression to ventilation ratio. So again, for every 30 compressions, perform 2 rescue breaths. If you're unable to deliver breaths and you go over 30 compressions, that's completely okay, as long as you prioritize chest compressions over your other interventions. For adult mouth to mouth and adult mouth to mask, pinch the victim's nose closed, tilt their head back, place your mouth over their mouth, forming a seal, or your mouth over the mask. Exhale 1 breath over 1 second into their mouth, watching for chest rise and stopping when you see the chest rise. Remove your mouth, allowing the victim to exhale over 1 second. Exhale 1 more breath into their mouth, watching for chest rise and stopping when you see the chest rise. Then resume compressions. If available and able, utilizing a bag valve mask or a BVM is the preferred method. Place the mask over the victim's nose and mouth with your thumb and index finger, using enough pressure to form a tight mask seal. Tilt the victim's head back while keeping a tight mask seal. Deliver 1 breath over 1 second, stopping when you note chest rise. Release the bag, allowing it to refill over a second, also allowing the victim to exhale. Then deliver 1 more breath over 1 second, again stopping when you note chest rise. AEDs are to be implemented immediately upon availability, during your chest compressions and rescue breaths. The person delivering the AED should be directed to work around the chest compressor to deploy the AED. So you're not delaying compressions, you're not pausing compressions while applying the AED. Some cardiac arrests are caused by disorganized electrical activity within the heart. In these specific cases, resetting the electrical system of the heart can restore organized and coordinated electrical activity, restoring the circulation of blood. The AED is able to determine these types of cardiac arrest and restart the heart by sending a large impulse of electricity through the heart, resetting it. To operate an AED, follow these 3 steps. Turn the AED on, place the pads on the victim, then follow the AED prompts. Make sure to avoid touching the patient while the AED is analyzing and during the shock delivery. For an adult patient, place 1 pad on the right upper chest as pictured, and place the other pad below the left armpit. Make sure to avoid placing the pads on breast tissue, over clothing, and over medical patches or bulges in the skin. Let's take a look at an AED being applied.
Adult patient. If the patient is a child, press pads firmly on skin. Do not touch the patient. Analyzing heart rhythm.
Here you saw the rescuer. As soon as they had an AED available, they turned it on. It started issuing commands. They've placed the pads appropriately on the patient as pictured. They're following the commands. They're clearing the patient. Once they deliver the shock, you see them resume chest compressions. If you have multiple rescuers, one person should establish themselves as a team coach. The role of the team coach is to ensure all important steps are being taken effectively and to promote effective communication. An effective team coach will identify and designate a person to activate 911 and ensure responders have access to the area. Identify and designate a person to perform chest compressions and switch them every 2 minutes. Provide encouragement and coaching to the chest compressor if and when necessary. Identify and designate a person to retrieve the closest AED and deploy it. Because again, you place the AED on the victim while chest compressions are happening. All of the steps of CPR need to be performed, and having a team with a team coach allows a resuscitation to happen quicker and with greater efficiency. In a little bit, we will circle back to performing adult CPR as part of our assessment. For now, let's continue on and talk about choking. Adults may choke for any number of reasons. It is important to quickly identify a choking adult and respond appropriately. A choking adult may or may not appear in distress, as the first few moments can be filled with confusion and panic. Pictured is an international sign of choking, which may or may not be present. You will need to determine if the victim has a complete airway obstruction or a partial airway obstruction. Is their airway completely blocked, preventing any airflow, or is it just partially blocked, allowing some airflow? For a victim with a complete airway obstruction, you will want to attempt to dislodge the object and relieve choking. Victims with partial obstructions that are able to move air and speak should be monitored until first responders arrive. Choking relief should only be attempted for complete airway obstructions, so let's review the two. A complete airway obstruction completely blocks a patient's airway and prevents them from moving any amount of air. They will not be able to speak, they will not be able to scream or call for help, they will not have any ability to breathe. In this case of a complete airway obstruction, attempt choking relief and call 911. In a partial airway obstruction, only some of the patient's airway is blocked, so they may have some ability to speak, they may have some ability to scream or screech or make some sort of noise. They may be able to move some amount of air. In this case, only call 911 and monitor the patient. You don't want to risk a partial obstruction becoming a complete obstruction. Adult choking relief may be performed with one of two methods: abdominal thrusts or chest thrusts. The most effective and ideal technique is abdominal thrusts, but requires you to be able to wrap your arms around the patient's abdomen. In cases where this is not possible and pregnancy, opt for the chest thrusts. And remember, if choking relief fails and the person becomes unresponsive, start CPR immediately. To properly perform abdominal thrusts, wrap both hands around the abdomen, just above the belly button. Form one hand into a fist with your thumb facing up and into their abdomen, and your second hand wrapped around your fist. Pull in firmly and brisk, repeatedly until the object becomes dislodged, or they go unresponsive and you start CPR. To perform chest thrusts is very similar to abdominal thrusts, except your arms are as high up under the person's armpits as possible. Chest thrusts should only be performed on pregnant people or people you are unable to effectively wrap your arms around their abdomen. To properly perform chest thrusts, wrap both hands around the chest under the armpits, and your hands over the lower half of their breastbone. Form one hand into a fist with your thumb facing into their chest, and your second hand wrapped around your fist. Pull in firmly and brisk, repeatedly until the object becomes dislodged. Pause the video here for a few moments to review. Go over your notes, go over the resources, including the student manual, to review the information that we've learned today. In a few moments, the video will continue. You'll get some hands-on practice utilizing adult CPR with our adult CPR assessment tool. Pictured is the adult CPR assessment tool. These are all of the steps that every student must go through in order to complete the adult CPR, AED, and choking relief module and become certified. You may perform this assessment as a solo rescuer, where you do all of the steps by yourself in order. Or, depending on the makeup of your class, you may work as a team and go through multiple assessments where each person is doing a different skill. Either way, you must perform all steps to be considered complete from the program. The first section is initial scene management. As you approach the patient, you need to check for breathing and responsiveness, but don't spend more than 10 seconds. Any time spent not performing CPR decreases the victim's chance of survival. Then, you need to call for help. You need to direct somebody to call 911 and get an AED. The instructor will inform you that the victim is not breathing, not responding, and does not have a pulse. It's at that point that you must immediately begin CPR. You should perform high quality CPR, which includes proper hand placement over the center of the chest, proper depth in an adult, that's 2 inches, allowing for full chest recoil so the heart may fully refill with blood, and a right rate and rhythm, 100 to 120 beats per minute for adult CPR. Then, provide rescue breathing, providing 2 rescue breaths after 30 chest compressions. You may use mouth to mouth, you may use mouth to mask, or you may use a bag valve mask. You may do any appliance, as long as you're getting 2 complete breaths for 30 compressions. While you perform breaths, do not delay compressions for more than 10 seconds. Ensure you have adequate chest rise and you stop your breath on chest rise. After 30 compressions and 2 breaths, you resume high quality CPR. It's at this point an AED will become available. You must deploy the AED while continuous high quality CPR is being performed. If you are performing this solo, your instructor will do chest compressions for you. If you're performing as a team, another team member will be doing the compressions. So then you turn the AED on, you properly place the pads on the victim, you follow the prompts of the AED, and understand different AEDs and different trainers may have prompts a little different, so follow the prompts that you're provided with. You then must safely deliver a shock. That means you're not touching the patient, that means nobody else is touching the patient, and the pads were applied properly. Immediately after shock delivery, you resume high quality CPR upon AED direction. Upon completing all of those steps, I'd like to congratulate you on receiving your certificate of completion for adult CPR, AED, and choking relief. Welcome to Save with CPR's Child CPR, AED, and Choking Training video. Today we're going to cover child chest compressions, child rescue breathing, child AED application and use, child team CPR, child choking, and then we will review the training. Chest compressions in a child require you to place one or both of your hands directly over the lower half of the victim's breastbone. You will need to lock your arm and push down about 1/3 of their chest or about 2 inches. You will then release all of the pressure off of the victim's chest. This should be performed 100 to 120 times per minute. Child chest compressions are very similar to adult chest compressions. However, you may perform one-handed chest compressions if you are more comfortable or to prevent yourself from going too deep. Make sure to ensure adequate chest recoil after each compression and do not rest on the victim's chest between compressions to allow the heart to fully refill with blood between each compression. Here we can get a look at a rescuer performing chest compressions on a child patient. Our child patients, again, are ages 1 to 8. You can use 1 or 2 hands placed in the center of the chest, 1/3 the depth of the child's chest, or about 2 inches at a rate of 100 to 120 beats per minute. It's really important to understand that one of the main reasons children and infants go into cardiac arrest is respiratory failure. That is to say, that rescue breathing in children and infants is extremely important. This rescue breathing allows you to replace depleted oxygen in the victim's blood. 2 options of rescue breathing are mouth to mouth, or you could also use mouth to mask, depending on availability, and bag valve mask ventilation. With either technique, you will want to provide 2 breaths, stopping once you notice chest rise for every 30 chest compressions. Now let's cover child compression to ventilation ratios. If you're acting as a single rescuer, you should perform a compression to ventilation ratio, or CV, of 30 to 2. That means after 30 chest compressions, you should perform 2 rescue breaths. However, children and infants have a higher baseline demand for oxygen, and low oxygen is a leading cause of pediatric cardiac arrest. So that means if you have multiple rescuers and can effectively do so, you should utilize a CV ratio of 15 to 2. That means if you have multiple rescuers, you should deliver 2 breaths after every 15 chest compressions. When giving child mouth to mouth or mouth to mask, pinch the child's nose closed or place the mask over their face. Tilt their head back, being careful not to extend too far. Place your mouth over their mouth, forming a seal. Exhale 1 breath into their mouth, watching for chest rise and stopping when you see their chest rise. Then, take in a breath, exhale 1 more breath into their mouth, just as before, having delivered 2 successful rescue breaths. To use a child bag valve mask, place a child-sized BVM mask over the victim's nose and mouth, using your thumb and index finger with enough pressure to form a tight mask seal. Then tilt the child's head back while keeping a tight mask seal without extending too far. Deliver 1 breath over 1 second, stopping when you note chest rise. Release the bag over 1 second, allowing the child to exhale, then deliver one more breath over 1 second, again stopping when you note chest rise. AEDs are to be implemented immediately upon availability during your chest compressions and rescue breaths. The person delivering the AED should be directed to work around the chest compressor to deploy the AED. Most AEDs have separate pads or modes for children and infants to deliver a lower energy. If present and able, use the child pads or child AED mode. If unavailable, you may use adult pads or mode on a child or infant. You may also apply an AED if you are by yourself and happen upon one. To operate an AED, follow these 3 simple steps. Turn the AED on, place the pads on the victim, and follow the AED prompts. Make sure to avoid touching the patient while the AED is analyzing and during shock delivery. For a child, place one pad on the center of their chest over the breastbone, with the other pad placed on the center of their back opposite of the first pad. Make sure to avoid placing the pads on breast tissue, over clothing, over medical patches, or bulges in the skin. If you have multiple rescuers, one person should establish themselves as a team coach. The role of the team coach is to ensure all important steps are being taken effectively and to promote effective communication. An effective team coach will identify and designate a person to activate 911 and ensure responders have access to the area, especially if behind locked doors. Identify and designate a person to perform chest compressions and switch them every 2 minutes or earlier if they get tired. Provide encouragement and coaching to the chest compressor if and when necessary. Identify and designate a person to retrieve the closest AED and deploy it. All of the steps of CPR need to be performed, and having a team with a team coach allows a resuscitation to happen quicker and with greater efficiency. Children may choke for any number of reasons. It is important to quickly identify a choking child and respond appropriately. A choking child may or may not appear in distress, as the first few moments can be filled with confusion and panic. You will need to determine if the child has a complete airway obstruction or a partial airway obstruction. Is their airway completely blocked, preventing any airflow, or is it just partially blocked, allowing some airflow? For a victim with a complete airway obstruction, you will want to attempt to dislodge the object and relieve the choking. Victims with partial obstructions that are able to move air and speak should be monitored until first responders arrive. Remember, do not forget to introduce yourself as somebody who knows choking relief and obtain permission to intervene. Let's take another look at comparing complete obstructions and partial obstructions. A complete obstruction, the victim has no ability to speak, no ability to scream, no ability to breathe. In response, we should attempt choking relief and call 911. In someone experiencing a partial airway obstruction, they may be able to speak, they may be able to scream or screech, and they may be able to move some air. In this case, we call 911 and monitor. If it becomes a complete obstruction, then we will attempt choking relief. Child choking relief may be performed with abdominal thrusts. To properly perform abdominal thrusts, wrap both hands around the abdomen just above the belly button. Form one hand into a fist with your thumb facing up and into their abdomen, and your second hand wrapped around your fist. Pull in firmly and brisk, repeatedly until the object becomes dislodged. If choking relief fails and the person becomes unresponsive, start CPR. Take a moment, pause the video, go through these questions on the screen, through the student manual, to be able to answer these very important questions. Once you've reviewed the next section of this video, we will break down the child CPR assessment tool and the actions you will be required to perform in order to complete the child CPR module. In order to complete the child CPR, AED, and choking relief module, you will need to be able to demonstrate and perform all of the skills required to do child CPR. When it comes to rescue breathing, you may either use mouth to mask, or BVM. You will be given a scenario for a child who has collapsed. You will have to respond appropriately. You may perform as a solo rescuer, doing all of the actions yourself, or you may work in groups to do team rescues. However, every individual must perform all of the different skills. The assessment tool starts out with the initial scene management, where you have to check for breathing and responsiveness, spending no more than 10 seconds, and then you must call for help, direct somebody to call 911, and retrieve an AED. You'll be informed the victim is not breathing, not responding, and does not have a pulse. From there, you will need to immediately start chest compressions, performing high-quality CPR with proper hand placement, proper depth, allowing for chest recoil with the right rate and rhythm. As a single rescuer, you will have to perform 2 rescue breaths after 30 chest compressions, without delaying chest compressions for more than 10 seconds, ensuring chest rise, and stopping on chest rise. If you're performing multiple rescuer CPR, you can use a 15:2 compression to ventilation ratio. You will then need to immediately resume chest compressions after giving breaths. The moment an AED becomes available, you will need to deploy the AED while continuous high-quality chest compressions happen, turn the AED on, place pads on the victim, follow the AED prompts, and safely deliver a shock if prompted by the AED, and resuming high-quality chest compression immediately after shock delivery. Welcome to Save with CPR's Infant CPR, AED, and Choking Relief Training video. In this video, we will cover infant chest compressions, infant rescue breathing, use of an AED for an infant team CPR, infant choking, and we will review. Chest compressions in an infant can be done with 2 thumbs or 2 fingers, depending on your need to move the infant. If the infant is on a hard, flat surface and does not need to be moved, wrap both of your hands around the chest of the infant with your thumbs resting on the lower half of their breastbone. At the same time, press both of your thumbs into the infant's chest about 1/3 the depth of their chest at a rate of 100 to 120 compressions a minute, fully releasing pressure between compressions. If you need to move the infant, rest them on your arm, supporting their head in the palm of your hand. With your other hand, place your index and middle finger over the lower half of their breastbone, compressing their chest about 1/3 the depth of their chest at a rate of 100 to 120 compressions a minute, fully releasing pressure between compressions. One of the main reasons children and infants go into cardiac arrest is respiratory failure. That is to say, rescue breathing in children and infants is extremely important. This rescue breathing allows you to replace depleted oxygen in the victim's blood. 2 options of rescue breathing are mouth to mouth, or mouth to mask, and bag valve mask. With either technique, you will want to provide 2 breaths, stopping once you notice chest rise for every 30 chest compressions. If you're acting as a single rescuer, you should perform a compression to ventilation or CV ratio of 30:2. That means after 30 chest compressions, you should perform 2 rescue breaths. However, children and infants have a higher baseline demand for oxygen, and low oxygen is a leading cause of pediatric cardiac arrest. That means if you have multiple rescuers and can effectively do so, you should utilize a CV ratio of 15:2. That means if you have multiple rescuers, you should deliver 2 breaths after every 15 chest compressions. In infant mouth to mouth or mouth to mask, place your mouth over the infant's mouth and nose, forming a seal, or place the mask over their face, forming that same seal. Tilt their head slightly back without going too far. Exhale while watching for and stopping when you notice chest rise. Allow the infant to exhale and deliver 1 more breath while watching and stopping for chest rise. To use a bag valve mask or BVM on an infant, place the infant BVM mask over the nose and mouth to form a seal without excessive pressure, which could compress the infant's airways. Tilt their head slightly back without going too far. You may consider placing some padding under the infant's shoulders instead. Deliver 1 breath over 1 second, stopping when you note chest rise. Then release the bag over 1 second, allowing the infant to exhale. Deliver 1 more breath over 1 second, stopping when you note chest rise. AEDs are to be implemented immediately upon availability during your chest compressions and rescue breaths. The person delivering the AED should be directed to work around the chest compressor to deploy the AED. Most AEDs have separate pads or modes for children and infants to deliver a lower energy. If present and able, use the child pads or child AED mode. If unavailable, you may use adult pads or the adult mode on a child or infant. As pictured, to operate an AED, follow these three simple steps. Turn the AED on, place the pads on the victim, and follow the AED prompts. Make sure to avoid touching the patient while the AED is analyzing and during shock delivery. For an infant, place one pad on the center of their chest over the breastbone, with the other pad placed on the center of their back opposite of the first pad. Make sure to avoid overlapping the pads. If you have multiple rescuers, one person should establish themselves as a team coach. The role of the team coach is to ensure all important steps are being taken effectively and to promote effective communication. An effective team coach will do the following. They'll identify and designate a person to activate 911 and ensure responders have access to the area. They'll also identify and designate a person to perform chest compressions and switch them every 2 minutes or sooner if they get tired. They'll also provide encouragement and coaching to the chest compressor if and when necessary. And finally, they'll identify and designate a person to retrieve the closest AED and deploy it. All of the steps of CPR need to be performed, and having a team with a team coach allows a resuscitation to happen quicker and with greater efficiency. Infants may choke for any number of reasons. It's important to quickly identify a choking infant and respond appropriately. A choking infant may or may not appear in distress. You may not hear breathing sounds or crying in an infant that is choking. You may notice their skin changing to a blue color, especially around the lips and fingernails. We'll talk about choking relief soon, but if choking relief fails and the infant becomes unresponsive, you need to start CPR. To rescue a choking infant, you should place your arm along their chest, supporting their head without blocking the airway. Tilt the infant downwards and slap their back between their shoulder blades 5 times using a forceful and brisk movement. Then roll the infant, supporting their body with your arm and tilting their head downward to provide 5 chest compressions. You will repeat this process until the object becomes clear. If the infant becomes unresponsive, you should start CPR immediately, and don't forget to call 911 when possible. Pause the video to take a few moments to review the questions on the screen. Next, we will be reviewing the infant CPR AED assessment tool used to complete your training. In order to be issued a certificate of completion for infant CPR, AED, and choking relief, you must be able to perform all of the steps required to perform infant CPR and AED. Using this tool, you may either perform a solo rescue with just yourself, or you may work as a part of a team. If you're working as part of a team, you'll have to do multiple rounds where every team member performs every single task. You'll be given a scenario with an infant that's unresponsive. You'll first have to perform initial scene management where you check for breathing and responsiveness, but for no more than 10 seconds. You'll then have to call for help, directing somebody to call 911 and get an AED. You'll be informed that the victim is not breathing, not responding, and they are pulseless. You'll need to initiate immediate CPR, performing high quality chest compressions, utilizing proper finger placement, proper depth, allowing for chest recoil, and implementing the right rate and rhythm. If you're by yourself, you'll have to perform 2 rescue breaths after 30 chest compressions, without delaying compressions for more than 10 seconds, ensuring chest rise with each breath and stopping on chest rise. If you have multiple rescuers, you'll utilize a 15:2 CV ratio. After delivering your rescue breath, you must immediately resume chest compressions. Whenever an AED becomes available, you'll have to deploy an AED while continuous high quality chest compressions happen. You'll need to turn the AED on, place the pads on the victim, follow the AED prompts, safely deliver a shock if required, and immediately resume high quality CPR. Welcome to Save with CPR's First Aid Training. In this video, we will cover principles of first aid, calling 911, medical emergencies, and traumatic emergencies. First aid is the initial care provided to a person suffering from a sudden illness or injury with the primary goal of preserving life, preventing the condition from worsening, and promoting recovery. First aid is typically administered by a layperson until professional medical assistance becomes available. The principles of first aid include remaining calm, assessing the situation, protecting oneself and the victim from further harm, and providing appropriate care for injuries or conditions. Knowledge of first aid is invaluable as it equips the individuals with the skills to respond effectively in emergencies, potentially saving lives and reducing the severity of an emergency situation. Calling 911 is a critical step in any emergency situation as it connects you with the professional medical responders who can provide life-saving assistance. When you dial 911, stay calm and speak clearly. Provide the dispatcher with your exact location, including any landmarks or cross streets that can help emergency services find you quickly. Describe the nature of the emergency and any specific conditions of the patient, such as unconsciousness, severe bleeding, or difficulty breathing. Follow the dispatcher's instructions carefully as they can offer vital guidance when help is on the way. Remember, timely communication with 911 can significantly improve the chances of a positive outcome in an emergency. Remember, these first aid steps are intended to provide immediate assistance until professional medical help arrives. Always prioritize safety and seek medical attention when necessary. A medical emergency is a sudden and unforeseen situation that poses an immediate threat to an individual's health, well-being, or life. These emergencies require urgent intervention to prevent serious harm or death. Examples of medical emergencies include cardiac arrest, severe bleeding, strokes, choking incidents, and severe allergic reactions called anaphylaxis. The hallmark of a medical emergency is its acute nature, demanding quick and decisive action to stabilize the patient, provide essential care, and ensure they receive appropriate medical treatment as soon as possible. Prompt recognition and response are crucial in mitigating the potential long-term consequences and improving the chances of survival and recovery. An allergic reaction is the body's immune system response to a substance that it perceives as harmful, even though it may not be harmful to others. When an individual with allergies comes into contact with an allergen, such as foods, medications, insects, pollen, or animal dander, their immune system reacts by releasing chemicals such as histamine. These chemicals trigger allergic reaction symptoms, which can range from mild to severe and may affect the skin, respiratory system, gastrointestinal tract, and cardiovascular system. Symptoms of an allergic reaction may include hives, itching, swelling, especially around the face, lips, and the tongue or the throat, difficulty breathing, wheezing, nausea, vomiting, or dizziness. The reaction may be triggered by foods, medications, insect stings, or other allergens. So check if the victim has any known allergies, check if the victim has an epinephrine autoinjector, and check if the victim may have been exposed to an allergen. If you suspect the person is having an allergic reaction, you should do the following things. If the person has an epinephrine autoinjector and 2 or more signs of an allergic reaction, help them use it immediately according to the instructions provided. Call 911 to start first responders. Then stay with them and provide reassurance until help arrives and to update 911 if anything changes. Pictured is the EpiPen. That's a brand name of one of the epinephrine autoinjectors. The way this device works is you slide it out of the case, you take the blue cap off of the end. You need to make sure that you hold the EpiPen with a closed fist so you don't accidentally leave your thumb over the needle and inject yourself. You'll then take the epinephrine autoinjector, you'll push it hard against the victim's leg as pictured here for at least 3 seconds. After the 3 seconds, you may remove the epinephrine autoinjector, having given a dose of epinephrine. Also keep in mind, they have adult epinephrine pens and they have pediatric epinephrine pens. So make sure you have the right one and it's prescribed to the victim. Diabetes is a complex medical condition that can lead to situations where the victim has too much glucose or sugar in their blood or not enough glucose or sugar in their blood, both with their own set of problems. So recognizing a diabetic emergency is fairly important. One of the biggest signs of a diabetic emergency is going to be altered mental status. You may view that as confusion, lethargy, or the person is unresponsive wholly. Symptoms of low blood sugar, which is called hypoglycemia, may include weakness, confusion, sweating, trembling, rapid heart rate, or loss of consciousness. Symptoms of high blood sugar, called hyperglycemia, may include excessive thirst, frequent urination, weakness, nausea, or confusion. In recognizing diabetic emergency, the two most important things to consider are: does the victim have a history of diabetes? And what is their blood sugar? So, what are the first aid steps for a diabetic patient? If the person is conscious and experiencing symptoms of low blood sugar, suggest that they check their sugar levels. If their blood sugar is low and they are able to swallow, give them a fast acting carbohydrate, such as fruit juice, candy, or glucose tablets. If the person is unconscious or unable to swallow, do not give them anything by mouth. Call 911 and stay with the victim. Difficulty breathing is where somebody is having a hard time catching their breath, getting full breaths, and ultimately potentially getting oxygen. Symptoms may include shortness of breath, wheezing, coughing, chest tightness, or bluish discoloration of the lips or fingernails. Difficulty breathing may be caused by asthma, allergies, respiratory infections, or other medical conditions. When identifying difficulty breathing, it's very subjective, so the ultimate person who's going to report being short of breath is the victim. If a person is experiencing difficulty breathing, there's a few things you can do to assist them. Help the person sit upright and lean forward to assist with their breathing. If the person has a prescribed inhaler or respiratory medication, assist them in using it according to the instructions provided. If the person's condition worsens or they show signs of severe respiratory distress, such as an inability to speak, gasping for air, call for emergency services immediately. Fainting is also known as syncope. It's a temporary loss of consciousness, typically caused by a temporary decrease in blood flow to the brain. Symptoms may include dizziness, lightheadedness, nausea, sweating, or pale skin. If a person feels faint or has fainted, encourage them to lie down, loosen tight clothing. If the person faints, check for responsiveness and breathing. If they are not breathing, start CPR. But either way, call 911 immediately. Heart attacks are caused by abnormal blood supply to the heart. Symptoms may include chest pain or discomfort, pressure, squeezing, fullness or pain on or around the chest, pain or discomfort in other areas of the upper body, such as the arms, back, neck, jaw, or even the stomach. Shortness of breath, nausea, or lightheadedness. Keep in mind, women and older adults may experience atypical symptoms such as fatigue, weakness, or indigestion. If the patient is not allergic, encourage them to take 324 milligrams of aspirin by chewing it. This would be 4 81 milligram baby aspirin. If the person is prescribed nitroglycerin and their symptoms persist, suggest they consider taking it as prescribed. Seizures are caused by disorganized electrical activity in the brain. These seizures can manifest as convulsions, muscle stiffness, loss of consciousness, staring spells, or involuntary movements. Seizures may be caused by epilepsy, fevers, head injury, strokes, or other medical conditions. If you find a person suffering from a seizure, keep the person safe from injury by moving objects out of their way and cushioning their head with a soft object. Do not restrain the person or put anything in their mouth. After the seizure ends, help the person into a safe position and provide reassurance. Don't forget to call 911 for this person. A stroke is caused by inadequate supply of blood to the brain, either from a blood clot or a bleed. Strokes can happen to anyone at any age. The signs of a stroke would consist of numbness or weakness to the face, especially one side of the face. If you have them smile and show their teeth and one side of the face droops down or doesn't have the same strength, that could also be a sign. Confusion or trouble speaking or difficulty understanding speech is another possible sign of a stroke. Trouble seeing with one or both eyes, changes in vision, double vision. Difficulty walking, being dizzy, imbalances could also be a sign of a stroke. Also, a severe headache could be a sign of a stroke. What's called a thunderclap headache with a strong and immediate onset, sometimes described as a thunderstorm in your head. If any of these signs or symptoms present, call 911 immediately. Stay with the person and be with them until help arrives. A traumatic emergency is a type of crisis that results from sudden, severe physical injury or impact to the body. These emergencies can arise from various incidents such as car accidents, falls, sports injuries, or violent acts. Traumatic emergencies often involve damage to bones, organs, tissues, and may result in conditions like fractures, spinal injuries, head trauma, or severe bleeding. The nature of these injuries often require immediate and specialized medical attention to prevent complications, reduce pain, and promote healing. Prompt and appropriate first aid response, such as controlling bleeding, stabilizing fractures, and preventing shock, is essential in managing traumatic emergencies and ensuring the best possible outcomes of the affected individuals. Bleeding is the loss of blood. Bleeding can occur externally from a wound or internally from damaged blood vessels. Signs of external bleeding may include blood flowing from a wound, soaking through clothing or bandaging, or pooling on the ground. Signs of internal bleeding may include swelling, bruising, pain, or tenderness in the affected area, along with signs of shock, pale skin, rapid heart rate, or rapid breathing. The first aid steps for bleeding are fairly straightforward. First, apply direct pressure to the wound using a clean cloth or sterile dressing to control bleeding, or your gloved hand. If bleeding persists, apply a tourniquet above the wound as you'll see in the next video. Call 911 and stay with the patient until help arrives. Symptoms of a broken bone, called a fracture, may include pain, swelling, bruising, deformity, and difficulty moving the affected limb or a grating sensation at the injury site. Open fractures occur when the broken bone protrudes through the skin, while closed fractures do not break through the skin. If you suspect somebody is suffering from a broken bone, immobilize the injured limb to prevent further movement and minimize pain. Apply ice packs or cold compresses to reduce swelling and alleviate pain. Seek medical attention promptly for evaluation and treatment of the fracture. Call 911 to have the victim transported to the nearest hospital for treatment. Burns can result from exposure to heat, chemicals, electricity, or radiation. Burns are classified into three categories. First-degree burns, which are superficial. Second-degree burns are partial thickness. And third-degree burns, full thickness. Symptoms of burns may include redness, swelling, pain, blistering, charred skin, or difficulty breathing in the case of inhalation burns. If you suspect somebody has suffered a burn, remove the person from the source of the burning and cool the affected area with cool running water to stop thermal burning only if the area is still actively burning. Then, remove any clothing or jewelry from the burned area unless it is stuck to the skin. Cover the burn with a clean, dry, sterile dressing to protect it from infection, and seek medical attention for severe burns, especially burns involving the face, hands, feet, or genitals, or burns larger than the size of a palm. Call 911 to activate EMS for a medical evaluation. Thank you for learning about first aid with us. This video serves as a general foundation with some good general principles to approach medical and traumatic emergencies. While we're unable to cover everything in these videos, we hope it serves as a good starting point. Your instructor may take some time after this video to review some of these techniques or different situations outside of this video.